People in the UK could be offered a third dose of the coronavirus vaccine from September. And they're not alone. The US plans to follow suit, and Israel's booster rollout is well underway. Booster vaccines are given to literally boost protection against viruses and diseases.
All vaccines, when you give them to people, over time do have a reduction in effectiveness. This is the same for every vaccine.
If you grew up in the UK, you would likely have had one aged 3 and again aged 14. Experts have found that protection from COVID in those double jabbed with Pfizer or AZ begins to wane within 6 months.
The average seems to drop about 3% a month. Our reasonable pessimistic guess is that by the end of the year, these percentage protections will be down to about 50%.
Research suggests effectiveness in the Pfizer vaccine after 1 month was 88%. After 5 to 6 months, this dropped to 74%. In the AstraZeneca vaccine, effectiveness after 1 month was 77%. This dropped to 67% after 4 to 5 months. The UK's vaccine rollout prioritised the vulnerable and healthcare workers. So by winter 2021, their protection against COVID could fall to below 50% in a reasonable worst-case scenario.
If our aim is to reduce the number of deaths and hospitalisations, then booster jabs are definitely what we should be prioritising.
The UK government is preparing to roll out boosters from September 2021. The Joint Committee on Vaccination and Immunisation has recommended they be administered with flu jabs for ease and increased uptake. Thousands of vulnerable Brits are expected to be offered a booster, and much like the initial vaccine rollout, groups of priority will be determined by the JCVI. Israel began rolling out third jabs at the end of July for those over 60. Since the middle of August, those over 40 have been eligible, as well as pregnant women, teachers and healthcare workers under 40.
I think it's very important to get the vaccine. I'm a teacher. I don't want to get sick, and I'm going to school next week. I want to be prepared.
Initial results showed a third jab for those over 60 offered 5 to 6 times greater protection against serious illness and hospitalisation from 10 days after the jab. Germany, Canada and France have also announced booster campaigns, and booster shots will be available in the US from the 20th of September.
This will boost your immune response. It will increase your protection from COVID-19.
Vaccines can be designed specifically to target variants of concern. There's currently no variant-specific boosters. They're effectively just a third dose, but there could be in the future. While some experts say urgent plans are needed for vaccine boosters, not everyone agrees.
WHO is calling for a moratorium on boosters until at least the end of September.
In some countries, vaccination rates remain as low as 1 or 2% of the population. Experts, including the director of the World Health Organization, warn that stronger variants could develop if vaccination rates aren't raised globally. The data shows that vaccines work against COVID, with countless hospitalizations and infections prevented and tens of thousands of lives saved. Experts say waning protection is to be expected and is not a reason not to get vaccinated.
The vaccines are currently protecting people against severe disease and death from COVID-19. And if people haven't had their vaccine, please come forward and get your vaccine.